First, I'd like to welcome Kelsey. She's a genetic counselor at the Colorado Center for Reproductive Medicine, CCRM. She works with people pursuing IVF and embryo genetic testing. Before her role at CCRM, she worked in prenatal genetic counseling. She completed her genetic counseling education at Augustana Sanford in South Dakota, but has lived in Colorado for 8 years. So let's give a warm welcome to Kelsey.
Great. Hi, everyone. Can you hear me okay? Okay, thank you for the thumbs up. Yes, my name's Kelsey. I'm a genetic counselor at CCRM. I'm really excited to be here today. Thanks for inviting me to join you and speak today about what I do, which is pre-implantation genetic testing in an IVF setting. So this is something we're able to offer patients for a variety of different inherited genetic conditions, Huntington's disease being one of them. And just to be absolutely clear, I am an employee of CCRM as well. So I wanted to talk about, there's a number of different, of course, risk-reducing reproductive options when there is a genetic condition in the family. I am going to particularly speak about assisted reproductive technologies. So that's going to be closest to me over here, PGTM, along with things like gamete donation. But of course, we know there are options like adoption and prenatal testing as well. I'm not going to go into too much detail about those, but they are available options. In terms of genetic testing, PGTM, that's our pre-implantation genetic testing for monogenic disease. That is what allows us to test embryos before transferring them into the uterus for pregnancy and reducing risk that way. And then, of course, gamete donation reduces the risk through either egg donor, sperm donor, or embryo donor. So we have lots of couples choosing a variety of these different options. So if IVF or assisted reproductive technologies feels like the right fit for your family, what are the first steps towards making that happen? So you would need to basically present as a new patient at CCRM or at the fertility clinic and meet with the physician. So this is going to be a physician that specializes in IVF and reproductive endocrinology and infertility. And then you will do a routine fertility workup. So just like any other patient at the clinic, you will go through fertility testing that might include like hormone testing, ovarian reserve testing, semen analysis, ultrasound, just to see what your eligibility standards is for IVF. You will, of course, meet with a genetic counselor as well, and we'll sort of talk through what the process will look like. And then the embryo testing itself actually takes place at a specialty lab called Reproductive Genetic Innovations out of Chicago. So I'll have a referral over to them. They'll sort of talk through the process with you. One thing that is very, very important to note if you decide you'd like to go through this process is that we must have some sort of documentation that there is Huntington's disease in the family. So that can be either a positive test report for the patient, that could be a positive test report for a family member, or it could just be medical documentation that it's in the family. So it doesn't necessarily have to be genetic testing, but we have to have some sort of official documentation that the patient is in fact at risk for Huntington's disease. And then once everything is set with RGI, the process to set up the embryo testing does take about 4 to 6 weeks on average. So it is kind of a lengthy process. Once the probe setup is ready and RGI confirms we're ready to go with testing embryos, we begin our thing at CCRM in terms of IVF cycles. So we do ovarian stimulation, medications in order to proceed with like an egg retrieval, and that takes 4 to 6 weeks as well. So I'm sure you're gathering this is kind of a lengthy process timeline-wise. In terms of just what is IVF? So IVF stands for in vitro fertilization. And this does require, like I mentioned, that 4 to 6 weeks of ovarian stimulation, and then it does require an egg retrieval surgery. So we actually go in and retrieve all of these eggs that we've recruited. We fertilize them in the lab, and then we grow those embryos out in the lab for about 5 or 6 days. We like for them to be large enough that they can be safely biopsied. So once they reach this safe stage at day 5 or 6, we will gently remove a small handful of cells, usually 3 to 6 cells per embryo. We freeze the embryos, and then all we're doing the testing on is those 3 to 6 cells that we've gotten per embryo. And we're actually going to be performing 2 tests on this DNA, the first of which is sort of like a chromosome viability test, and then the second would be the Huntington's disease testing. We're able to do both of those tests on just that small handful of cells. So there's a couple of different ways that you can go about testing for HD in embryos. This is going to be the more quote unquote straightforward way. This is when a patient presents to us and they have a personal positive test report. So we know that they personally have or are at risk with Huntington's disease. And so we know in this instance, there is a 50-50 chance then with each conception or each child or each embryo to inherit it. This is when all cards are on the table. So we will disclose the results of your fertility workup to you. You will know, generally speaking, how many embryos that we're hoping to get for your IVF cycle. We'll know how many we expect to pass the chromosome viability testing. We'll give you a better idea of your prognosis. And then at the end, you'll get a report and you'll know how many embryos were created. You'll know their chromosome status. You'll know their HD status and everything like that. So the next is a little less straightforward. This is what we call non-disclosure, PGTM. So non-disclosure pre-implantation genetic testing, it actually does not require that the patient in front of us knows their Huntington's disease status. So this is a great option for people who don't want to proceed with testing or don't want to proceed yet. Basically, what makes this a little bit tricky though is everything is blinded from the patient. So RGI, that testing lab that will eventually do the embryo genetic testing, they are going to completely de-identify and actually test the patient for Huntington's disease. But that result is never disclosed to the patient. It's not even disclosed to CCRM. So your physician won't know your status. You won't know your status. Nobody in the building will know your status. And all of your fertility workup is blinded to you as well. So you will not know going in how many eggs we're expecting to retrieve, how many we're expecting to fertilize, how many we're expecting to pass the chromosome testing piece. So there is no way for you to deduce based on the results of your workup whether or not you may or may not be at risk. So this is a great option. What does make it a little bit tricky is it is very gray going in. So you do kind of have to go into the whole process blind. But ultimately at the end, you will know, yes, you have, the embryos available for your desired family size, or no, you don't have enough embryos available for your desired family size. You will not know whether they were, if we just didn't get enough because of a fertility workup, we won't know if they're excluded based off of chromosome status or HD status or anything else. So we get a lot of families who choose this option simply because they prefer not to know their status. Okay, I should have given you a warning shot before I put up this slide. So estimated costs, unfortunately, I think we can all understand that IVF is just generally speaking a rather expensive process. I have put up general numbers for self-pay price. So this is not including any insurance. This is not including any grants or anything of that nature. Those things are available. Colorado is, especially in Colorado, insurance coverage is quite a bit better than it can be in other places. But just to give you an idea of potentially max out-of-pocket costs. So the diagnostic testing for IVF, so this is just determining fertility status. It can be around $4,000. The IVF cycle, including the embryo transfer. So again, that's the egg retrieval surgery. And that 4 to 6 weeks of ovarian stimulation, that can be quite pricey as well. The genetic testing with RGI is an additional cost. And then I've also included the gamete donor costs as well, in case that route makes more sense, depending on your preferences. So I know that was kind of an intense slide, but I will end on just the genetic counselor's contact information. So this is the email for the genetic counselors at CCRM. There's 4 of us, and our direct phone number. We are happy to talk with families or individuals at any point at no charge to just review this process in more detail, especially the things like cost, insurance coverage, next steps, what the testing looks like. So please feel free to contact us at any point in time with no commitment, no meeting with the physician. You're welcome to contact us at no charge, and we're happy to answer any questions you have.